Tawana.
Hi.
My name's Isabel. I'm going to be your student nurse today. Can I just have you verify your name and date of birth for me?
My name is Tawana. My date of birth is 12/28/83.
Okay. And what brings you in today, Tawana?
I am here regarding my A1C results.
Okay. So I do have the results here. I'm going to go ahead and give you this. You can take a look at that.
Okay.
And then I am going to take a seat and we're just going to discuss some of this stuff, okay?
Okay.
So, your last lab draw did show that your A1C was 5.8. And now we did a more recent one, and I do see that it's 7.6.
Okay.
So this does put you in a range for being type 2 diabetic,
Okay.
because anything over 6.5 we do consider to be a type 2 diabetic range.
Ooh.
And do you know much about type 2 diabetes?
I do not. Can you tell me a little about it?
Yeah. So type 2 diabetes is when your body produces insulin, but there is a problem with the insulin production. And insulin is a hormone that helps control your blood sugar. So some things that can put you at risk for type 2 diabetes are growing up with bad eating habits, being obese, living an unhealthy lifestyle such as eating out all the time, and then ethnicity can also play a role in that.
Okay.
So have you been having any signs and symptoms or any strange things going on recently?
Yes, actually I've been urinating a lot, and I noticed that my wound on my foot is not healing too well. And I've noticed I've been really thirsty and tired lately.
Okay, so yeah, these are some pertinent signs and symptoms of type 2 diabetes. So I do just want to educate you on some other signs and symptoms that you may see being a type 2 diabetic.
Okay.
So you might see some weight gain or loss that you weren't planning on. You can have blurred vision, and then you also can be feeling hungry often, and then you can experience tingling and numbness in your feet. So before we start type 2 diabetics on meds, we usually do like to do lifestyle changes first. So could you just tell me a little bit about your activity status and your eating habits?
Well, I try to work out at least 3 days a week. I eat healthy, but I do eat fast food once a week, I would say, just because I work a lot and it kind of goes with my work schedule, and it's just easier to grab.
Understood. So it does sound like you're off on the right foot for exercise. But just to add, it is good to work out at least 3 to 4 days a week for at least 20 to 30 minutes of aerobic activity, which could just be like bike riding, walking, anything like that. So for type 2 diabetics, it is also important to maintain a healthy diet. We do want that diet to consist of carbohydrates, but not too many. So I would just have you pay attention to your labels when you are eating. And then also we do need to add some protein and fats in your diet.
Okay.
So some of the things that you could eat would be some white rice, sweet potatoes are good, plain bagels. For your protein, some good things are scrambled eggs, baked fish, baked chicken. We like to stay away from the fried processed stuff. And then some snacks that you can also have around your house to snack on are some cherries, some plain yogurt, and then popcorn with minimal butter and salt, obviously.
Okay, that sounds good.
All right, so if lifestyle changes don't work, we do like to start talking about drug therapy. So when you try to make those lifestyle changes, but it isn't really doing anything for your A1C level, then we do like to implement some drug therapy. So we typically do start patients on metformin, which that drug, it goes ahead and reduces the production of glucose in the liver, and then it maintains your blood sugar levels as well.
Okay.
So with metformin, it should be taken by mouth and with food. You also will need to have frequent lab draws done. So we probably will have you come in around every 3 months, get some labs just to make sure that the medication's working. And then if the oral medications don't work, we may start you on an insulin, which is injected subcutaneously. And if we do get to that point, it will be an injection in your arm, in your stomach, or in your outer thighs here.
Okay.
But hopefully we won't have to get to that point, so we can do some lifestyle changes, and then we'll start you on the metformin, so hopefully we don't have to get the injectable stage.
Okay.
Some other things I am going to educate you on is when to call the provider. So you should always call your provider when you have signs and symptoms of hyperglycemia and or hypoglycemia. So hyperglycemia, you can have very fruity breath, You'll feel hunger all the time. You can have nausea or vomiting. You're gonna have that increased urination like you told me you already had. You can have fatigue, blurred vision, and then excessive thirst. So those are all signs and symptoms of hyperglycemia to watch out for. And then we also do have hypoglycemia, which is when your blood sugar is too low. So for that, we're gonna notify the healthcare provider if you're shaky, if you're sweaty, dizzy, increased confusion, increased hunger, if you're feeling weak, if you have a headache, and then you can also feel very nervous on that.
Okay.
So do you have any questions for me, Tawana, regarding diabetes?
When should I come back and get my labs drawn?
So we typically will have you come back and get labs drawn every 3 months. So
Okay.
in about 90 days, and we'll have you go out to the receptionist and she can go ahead and she'll schedule an appointment for you for that.
Okay. Thank you.
All right, you're welcome. You have a great day.
You too.